Dr. Jaffe, the first question I have is regarding the LRA. Um, uh, how do we decide what to test when checking for a specific sensitivity? For example, what part of an apple would we test? Like, how do we choose the antigen of the apple, and how do we decide what type of apple to take the antigen from?
Yes, let's take the question of apple, of which there are at least 24 varietals, that is, at least 24 different kinds of apple, are available in the United States fairly easily. And some heritage kinds of apples, like Esopus Spitzenberg, Thomas Jefferson's favorite apple, from local gardens and places. It turns out there's a family of foods, and the family is called POM, P-O-M, of which apple is one of the common cultivars, subtypes. But the definition of an apple, whether you're talking about a Gala or a Macintosh, whatever apple you're talking about, whatever apple kind you're interested in, has the same common POM apple antigen. So we pay a lot of attention because, as you know, we purify our own antigens. We don't consider the commercial sources adequate. And I guess you could imagine drawing many, many, many ounces of blood and being able to tell people that a Macintosh apple was different than a Granny Smith apple for them. But that would be very unusual because in common to all kinds of apples are the POM antigens that make an apple an apple. So it turns out it doesn't matter what the source of the apple is. If you're sensitive to apples, you're sensitive to apples. Now, I can imagine that there would be an individual who would be sensitive to one kind of apple and another. But imagine, my friend, if you wanted to test all of the different subcultivars of apples, if you wanted to test all of the different subcultivars of pears, all of the different subcultivars of carrots, all of the different subcultivars of foods and vegetables and fruits and so forth. Now we would need to draw a unit of blood, not an ounce of blood. We would be doing thousands and thousands of cell cultures, not hundreds and hundreds. And we would not be improving the predictive value. We would not be improving the sensitivity of the test. We would not be improving the specificity of the test. We have the most precise reproducible test. We have the most. Somebody should stop knocking their microphone. Somebody should stop knocking their microphone because it interferes with the comment. We want to test for what's important. We want to test for what's important. I'm going to keep saying it until we get it without a microphone knock. We want to test for what's important. What's important is the botanical source of the food family. In the case of apples, those are POM fruits. You want to be able to know the difference between apples, pears, nectarines, peaches. But whether the antigen was extracted from a green or a red apple has nothing to do with the immunoreactivity of apples. And it's an interesting question because people who like apples will say to you, well, gosh, aren't there some apples I can eat and some apples I should avoid? And that's a theoretical question that we don't have an absolute answer to. But the practical answer is that LRA tests were developed based on a knowledge of food families, based on a knowledge of botanical speciation. And we paid attention to what was important, and we didn't pay attention to such detail that we would end up requiring much larger amounts of blood, much larger amounts of money and would be marginally, if at all, improving the outcomes. So it turns out an apple is an apple, and a pear is a pear, and there's a reason why an apple is an apple, there's a reason why a pear is a pear.